Hello, this is Dr. Stephen Cohen, and this video segment is a brief course on interpreting the OCT line scan, just focusing on the inner retina. The inner retina runs roughly from the nerve fiber layer, the bright line on the surface of the retina, out to the outer nuclear layer, which is the nuclei of the photoreceptors. Looking at the line scan, we're looking for four different things. One, if there's an abnormal growth or deposit that should not be there. Secondly, if it's too thick, or if it's too thin. And finally, if it's disorganized. Starting off with something that shouldn't be there, one of the most common things you'll see on these line scans is an epiretinal membrane. It's a bright line, usually sitting in front of the retina. And sometimes there are little spaces between it and the retina, but sometimes it's not detached at all from the nerve fiber layer. The second thing you'll see sometimes is a growth on the inner retina is lamellar whole epiretinal proliferation, which is shown here, and is a line on the inner retina, but it's less reflective than an epiretinal membrane, and histologically it is distinct. Turning to a retina that's abnormally thick, you can see on this scan the retina on the right side of the image retains its normal architecture. On the left side, the retina is thick, and this is a vertical scan through a patient who had a superior branch retinal artery occlusion and acute vision loss. There are two situations where the inner retina might look thin. One would be after an acute ischemic event when the retina cells have died and the inner retina thins out. The second is iatrogenic, where sometimes after macular surgery with an adherent macular pucker, there is an inadvertent removal of some of the inner retina, which can be seen on the OCT scan and sometimes does manifest with vision loss. Finally, disorganization of the retinal inner layers is an entity that's sometimes seen in diabetics, such as this macula, where you can see instead of the nice linear bright dark lines you would see on an OCT scan through a normal eye, the inner retina is disorganized. You can't make out where the plexiform layers are and where the nuclear layers are, and this is an eye that's had damage, likely from ischemia and hemorrhage, and the retinal layers are disorganized to the point where sometimes this will affect the vision. So in conclusion, the four things that we're focusing on when interpreting OCT line scans are: first, is there an abnormal growth or deposit, something that should not be there? Second, is the retina too thick? And third, is the retina too thin? And finally, is the retina disorganized? That's to say, is there an absence of the normal retinal architecture? This is the course on just the inner retina. We'll be covering other aspects of the retina in other parts of the course, and also we're treating the fovea as a separate entity.